If your hips are uneven, if you have soreness in your pelvis or pain down here in your lower back, I'm going to show you how you can take care of that at home in this video. In most instances, this misalignment at the hips is caused by sacroiliac joint dysfunction or SI joint dysfunction. Now, what in the world does that mean? Our pelvis is made up of 3 bones. You have an ilium on both sides and a sacrum right here in the back. Where they come together is known as your sacroiliac joint. Now, we call it a joint because it's where 2 bones come together, but really there should be no motion that occurs there. However, when motion does occur there, either with an injury or maybe sitting or standing with poor posture all the time, you can cause some shift to occur in that area. That's what causes this malalignment at the pelvis. That's also what causes pain kind of in that area down in your lower back. To assess this on yourself at home, what I want you to do is stand in front of a mirror and with your hands, place your hands right on top of your hip bones in your sides. You should be able to kind of dig in and feel where the top of your hips are. Now, where are your hands? Are they even with each other or is one higher than the other? Then the other thing that I like to do is follow that bone, follow that ridge all the way to the front, right to that belt line, and you're gonna feel kind of a bony prominence under there. If I were to put my knuckle like this and push on it, that's kind of what it would feel like under your skin. As soon as you find that area, do the same thing. Put one finger on those areas and see where that alignment is. Are they even or are they uneven with each other? Now, full disclosure, no one is completely symmetrical. There might be some slight variation to this. However, if you notice a marginal difference with pain in that area, that's a good indication that you might have some of this SI joint problem going on. Now, what do we do about it? The first thing we need to do is realign your pelvis and get those bones in the right position, and then follow that up with strengthening exercises that are going to stabilize those bones in that position as well. Both of those things are included for you in this video, coming at you right now. Let's first start with a mobilization technique to put the bones in our pelvis back into a better alignment. You are going to need something to help. I've got a golf club, a PVC pipe or a dowel or a cane also work well. I used to tell people like a broom handle or a mop handle, but keep in mind sometimes those are kind of flimsy and hollow. We have bent some brooms with this, so use at your own risk. I'm going to show you with a golf club. I think that that works the best. What we're going to do is lay down on our back, and then in theory what I want to do is put the handle of this on the top of the thigh of the hip that was higher. So if my left hip was higher as I look in the mirror, put that golf club on top of that left hip. The right leg is going to cross over the top of the golf club, so it's right here in my right hamstring, kind of behind my right knee. Now in this position, I'm going to hold nice and firm with my hands, and then I'm going to pull up with my knee, so my left knee is pulling up into the golf club while my right leg is trying to push down into the golf club. And I'm going to hold that contraction really hard, 2, 3, 4, and 5, and then relax. And what I would do is I would repeat this 10 times for 5-second holds, and then I would stand up and see if we made any difference to it. So stand up, check your hips again, find those bones, see if that's any different, see if it feels any differently in the back. If it does, then that's an indication that that's the right mobilization for you. However, sometimes things behave a little backwards. If you didn't notice any change or if it's still painful, you might try to repeat that in reverse. And so now what I'm going to do is put the golf club on top of my right thigh and underneath my left, and then I would repeat the same thing. Really hold, really try to contract for about 5 seconds, repeat 10 times, and then again, stand and see what kind of change we made. You should notice that one of them makes more of a change visually and then also elicits more of a change with whatever pain you might be feeling in your back. Then that's an indication that that would be the correct technique for you. And what I would recommend is that you repeat that daily, 5-second holds repeated about 10 times. Now I'm curious, leave a comment down below. Did you notice any improvement with that mobilization technique? I always love to hear from you. But then the next thing we need to do is once we have it in proper alignment, we need to do the right strengthening exercises to keep it there. Those are coming at you right now. Now that your SI joint is in a better alignment, let's keep it there with some of these stabilization exercises. So the first thing we want to do is some clamshells. You're going to lay down on your side with both knees bent. Now keep the soles of your feet together. Use the muscles here in the back of your hip to pull your knees apart, up towards the ceiling. Hold 1, 2, 3, and then return back down to that start position. You should feel the muscles working right back here, deep in your hip. It's these deep hip rotators that are working to pull the knee up towards the ceiling. Nice and slow, make sure you hold it at the top. Typically on this, what I recommend is a set of 15 to 20. And then if that feels good, let's do that 3 times. And then I always like to keep that even. I would do those on the right as well as on the left. The next exercise that I like is going to be a side-lying abduction. We're going to lay in this same position, but now I'm just going to extend this top leg out straight. With that leg straight, what I want to do is focus on pulling my heel up towards the ceiling, slightly behind me, and then return right back down to that starting position. You're going to feel that again kind of deep here in the glute, maybe up here a little bit higher as we work through that glute med muscle. This is a great way to strengthen and stabilize the pelvis. And again, about 10 to 15 repetitions on this, repeated 3 times, but then let's keep it symmetrical and perform these on both legs as well. That was the hip abductors, so these muscles that abduct the hip. We want to keep things symmetrical, and so now we're going to work the hip adductors. Now for this exercise, the easiest thing to use would be a pillow doubled over. If you have like a small ball that like your kids play with, that works well also. And so you're going to lay down on your back with your knees bent. Again, I've got that pillow doubled up and then right between my knees. What I'm going to do is squeeze my knees together, smash that pillow, hold 1, 2, 3, 4, 5, and then release. And so smash and hold 2, 3, 4, 5, and then relax. Sometimes with this one, you might even get a pop right back in that SI joint that should feel pretty good. That's an indication that we've relieved some pressure in that area. And so if that's your case, I hope you get some relief from that. And about 10 to 15 repetitions repeated 3 times on this. And then the last thing I like to train would be your hip extensors, so your glute max muscle here in the back. What I want to do is some bridges for that, and I like to hold these ones a little bit longer. Laying on your back, knees bent, you're going to smash your glutes together, so contract your glute muscles to lift your hips up towards the ceiling, but then we're going to hold this contraction for a 5-second count up here at the top, and then return back down. And so smash and hold, and then up here at the top, we're really focusing on squeezing those glutes together. It's a really firm contraction right here at the top. We're going to hold for 5 seconds and then return right back down to the starting position. About 10 to 15 repetitions repeated 3 times is a great number to shoot for. If you need more help with your SI joint, check out this video right here. If you haven't subscribed to Tone and Tighten yet, hit the circle here to do that. I'd love to see you back for future videos. Hope this helps you to feel better. Hope to see you again soon.